Welcome to the office.
Hi.
Welcome to the office.
Gracias.
Nice to meet you.
Nice to meet you.
So we got a few things going on over here, okay? We're gonna go over your x-rays
Mm-hmm.
and just briefly explain kind of why you're here. And you're here because you had knee surgery, ACL reconstruction, and from that you're getting a lot of hip pain, correct?
Correct.
So your number one issue of being here is?
My knee surgery.
But I'm not treating a knee surgery.
No. My hip pain, my tailbone pain.
Tailbone pain and
Hip pain.
And hip pain.
Mm-hmm.
Number two was?
Number two was my knee.
Okay.
The pain in my knee.
Okay.
The range of motion, the lack of motion.
So there's a lack of motion in the knee, and we're gonna check that when we do the exam, okay?
Okay.
And what about the neck and the mid-back?
Yes, there's also pain within my neck, the top of my neck, and then the mid back as well.
Okay. I'm gonna go over your x-rays, and then when we start the exam, we'll have a little bit more conversation. I just wanna go over kind of what I see here and what was predisposed. And you had the knee surgery when?
2020, July.
July 2020, and you were told you were gonna have pain after it,
Then I was gonna have issues with my hip.
but wasn't explained why.
No.
Okay.
Yeah.
And you're going to bring us some post-surgical knee x-rays to take a look at later,
Right.
Mm-hmm. So for today, let's go over your full spine x-rays.
Mm-hmm.
And this is what I need people to see. And so, you know, I've talked about this in terms of foundational work, and this Gonstead work that I do is based on the level foundation principle. If we don't have a level base and foundation, then anything else we do doesn't really matter, right? Now, what we can see here is this. We can see that the left hip is slightly shorter than the right. You can see the obturator on the left is slightly smaller than the right. But more importantly, you can see the tailbone is tilting right around S3, S4. So your tailbone tilts to the left side. There's an inferiority listing of the tailbone, and there's a little bit of twisting of the pelvis. Let's look at the numbers, and this should all make a lot of sense. Now, we have a measured difference of 5 millimeters of the hip. So your left hip is 5 millimeters shorter than your right. You have a rotated sacrum on the left on the side of an IN ilium. Now and we have a 3 millimeter drop of the sacrum. So from my interpretation, there was an old tailbone injury. There were probably multiple. You played?
Yeah.
Okay. Let's put it together. I'm going to use my hand as the model. The left side, the sacrum on the left goes back 2 millimeters and down 3. The pelvis on the left side turns in, and then the hip is down 5. So the overall effect is doing what? It's putting all this stress. It's bringing this down, and where's all the stress?
Right there.
Medial meniscus and the ACL and the MCL. What is that? I think there's something going on outside, but we're not going to deal with that right now. Hold on, what the hell is that? So, whatever, there's some noise out there we can't seem to figure out, but that's okay. So, from your foundation, that's what predisposed your knee. And when the knee thing happened, I'm just curious as to why you were told that, but it is true. Whatever you had here, that was already going to happen anyway. Okay? Make sense?
Makes sense.
All right. So we have the foundation to deal with. Now, this is where my interpretation is a little bit different from other people. And when we look at the tailbone, I've talked about this, you have a couple of injuries. So I can see a nub here. So the way I was taught is this should be relatively smooth. There can be a little bit of variation, but you can see this is not part of the normal look of your tailbone. We have a coccyx going slightly forward. But whatever happened, something happened down here. And when I look at the tailbone on this side, I can see that it's bent. Do you see what I'm talking about? So the question is, now, whatever it was, we'll deal with it. Now, here's the cool part of the Gonstead analysis. When you have an IN ilium on the side of a rotated sacrum, the book says do the sacrum. If I work on your ilium, the measured difference becomes the actual difference. It becomes worse. So the answer isn't in your pelvis. Getting adjusted on both sides of the pelvis is not your answer. Make sense? All right. Oh, hallelujah. 10 points. C1, left side. You're holding a lot of trauma in your body, lady. You know that, right?
Mm-hmm.
20 points. Look, it didn't stop yet, though. Bam. T9, T10. 15 points. That's the B button. And it's all starting down low. S4. Maybe S5, coccyx. Right there. I'm getting here, 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 and here. That doesn't mean I'm adjusting all of those. It means we're going to check it and we're going to determine where we're going to start. Relax there now. 5, 6, 7,
No smog?
8, 9.
Oh.
9 or 10? 9. Yes?
Yeah.
9. 2. Alright, we have T9. Let's check the pelvis. Scoot forward. Scoot forward, feet together. Open and close the knees. Open and close the knees. Left side only. So when she does the left, the right is fine. Do the right side. When she does the right, the whole left wants to shift, but she's not opening enough. You have more flexibility on the right, correct?
I feel like I have more flexibility on my left, actually.
Go do your left side.
I feel my right is more tense.
When you do the left,
When
or
I do
generally
the right.
speaking?
Generally speaking.
Well, that's because it's been compensating
Yeah.
for your left side. But what I'm feeling right now is when you do your right, you have more in and out of your right. It's smoother.
Mm-hmm.
When you do the left, this whole thing is stuck here.
Oh yeah, I feel that.
Okay, look, I'm gonna push hard here.
Yeah.
And then I'm gonna push here.
Yeah, I feel that.
You feel the difference there? Scoot back for me, please. Now the fun part. L5, S1, S2, S3,
Oh.
S4.
Oh.
Back towards me. Ready?
Poquito.
S5. So it's either down here, S5, or S4.
Oh.
They're both tender. S4. Right there. And to the left.
Oh.
Which one is more tender to you?
I think that top one.
S4. And check this out. I want you to see this. This is a puffy sacrum. This is swelling. This is inflammation. So after sacrum, we're going to recheck this. You feel what I'm doing here?
Yeah, I've
That's
seen
swelling.
it. Yeah.
C7, T1, sorry, C7, 6. 6. 6, 9, S4. Okay, relax there. Hey, Shasha.
How you doing?
C6.
Ooh.
Gotcha. Oh my.
That took a lot of trust from me. You know
What's that?
I said that took a lot of trust from me.
You did it. Check it out.
Ooh.
Turn left.
Oh yeah, I feel that.
Turn right.
I feel that actually. I feel like I opened my hearing up a little bit.
Come over here. Let's go face down. So what are we doing? We got it dropped. Yeah, we got to torque it up on that left side, okay? That's a little bit. Relax the shoulders, please, please relax. Normal breath. Gotcha. want to, but you're holding.
I'm holding it.
You're holding it. Keep walking. You're holding it.
Come on, come out.
We got a piece of it. Go left side down. Sorry, go right side. Over here when you're ready. You're gonna make me work for it.
Make you work for this one.
Right side down. You good?
Yep.
Happy place?
Yeah.
You need a cobra. Hold the wrist, please. Hold the wrist.
I'll hold the wrist.
Hold the wrist. That's torque.
Oh.
Gotcha. Is that okay on your knee?
Yeah, okay.
Okay. Deep breathing. Hi.
Ooh,
How you doing?
good.
Come on. Come on. Stand up and walk it up. Check it out. As you're walking, tell me if anything's different.
Yes, I do feel a difference.
Keep going.
Oh my gosh. Just relax.
There we go. Aha!
Is that better?
It's moving a little bit more.
Yeah, definitely feel it.
Good.
I'm so excited.
Nice.
Thank you.
How's the knee?
A lot better,
I
actually.
didn't touch the knee.
I know you didn't. It feels more in place.
Keep walking. Walk one more time back and forth. Anything else different? Knee feels better?
Yeah,
Back feels a little different?
yeah, it does. I used to feel this thing in my bottom of my foot, and then this like hard, like where I couldn't like flex it out before. Now I actually feel like it matches a little bit more. Like this used to be a little bit more like that.
You weren't able to fully extend
Extend
your knee.
it, yeah, the range of motion. And I actually felt it down here, and now when I walk, I don't feel it. Yeah. So,
Keep going. Even better than that is the swelling in her sacrum has come down.
praise God.
Mira. Check it out. So, still there, but it's less. Sit up straight. Easier to sit?
Yes.
Yes. T9 is clear. Sacrum is clear. 6 is clear. Shoulder.
Oh.
On your back, please, we're going to work on your ankles. Now, for the ankle, let's do the right one first.
Whew. Damn.
Left side up. Relax there. Is that okay in your knee? When I do that? One.
Wow.
Sit up and turn. Walk it off again, please. Check it
Oh
out.
my gosh.
Check it out.
Wow.
Wow, what? Que bueno.
My ankles.
Que bueno. Habla español.
Muy bueno, gracias. Excelente, eh?
Excelente. Okay, so we're looking at the deviated septum. This side, that side doesn't move as well. So we're doing the right septum, right to left. Chin down. Chin down, look down. Good. Breathe through your mouth.
Ooh.
Spicy. A little more, actually. Poquito. That's it. Gotcha. In through your nose. Questions?
When is the next visit?
Ah, that's the best question they ask.
Yeah.
Keep walking. Now let's do the hands. Squeeze.
Oh, I'm super excited about this.
Squeeze. Relax the shoulder.
Oh.
Squeeze. You're like, ah!
Screamed at me.
Squeeze!
Yeah,
Bueno,
so
squeeze. Alright, relax there.
So funny.
You crack your joints?
Oh, yeah.
Stop.
Stop. Okay. Ooh. Ooh.
Squeeze. So today is Friday.
Mm-hmm.
We'll regroup on Monday.
Okay.
Tuesday the latest, okay?
Ooh.
And then the end of the week.
Okay. Ooh.
Squeeze. Nice. Squeeze. Homework. 12, 15, 16,000 steps a day. Drinking 2 to 3 liters of water a day. Icing the areas that I adjusted.
Okay.
Stand on one leg. If you need it. 2 minutes eyes open, 2 minutes eyes closed. Other side please, there's the fun one. Check it out.
Yeah.
A little easier.
Yeah. It's actually straight.
Hmm? Okay?
Awesome. Excited.
Any other questions?
No.
Welcome to the
Thank
office.
you.
You're welcome.
Appreciate you.